Anyhow, welcome everybody. I'm impressed, like everybody's commitment is the holidays, and we certainly have an excuse to check out this year more than any other year because it's been a hard year. I'm glad 2020 is over, won't miss it at all. I'm looking forward to 2021. I think, with this project, Prevent, when you work in the emergency department, you come across people who don't believe in vaccination just generally. And I'm always sort of struck by that and kind of think about my role and maybe, taking a few extra moments to talk to them about vaccination, like the usual ones. And same thing's happening with COVID. And I think with Prevent, besides the fact that many of us are sort of the next wave of guinea pigs, when people, ask us about what we think of the vaccine, we're being vaccinated first. And this effort is going to add more data about the effectiveness and safety of the vaccine before this becomes more available to the public. So anyhow, we're doing something good as we're, dealing with, unfortunately, a pandemic that's even more out of control. We, at least ourselves, we're starting to get better protected. So that's great. And, thank you everyone for your commitment as we go into this next year and get this project off the ground. Nick, do you want to say anything before you introduce Alicia?
No, I don't think so. I think that we probably can go ahead and get started. This has been a great group. Everybody knows that. And we have launched this project extraordinarily quickly. And the fact that I know that we've been getting emails from all of you during the middle of 2 holiday weeks here, and that the day before New Year's Eve, we're all doing medical record abstraction training so that we can get this launched. I think it's just a testament to the commitment at each of the sites. And we just wanted to express how appreciative we are of what you're doing, because this is hard. And there are a lot of elements of this project, and you're all doing a great job getting it launched quickly. For the training today, I'd like to introduce Alicia Horscher. She works here at the DCC at the University of Iowa, and she's going to be leading the group that is going to be going through the medical record abstraction. One of the really important parts of this project is validating the results that we get from participants, and also grading severity of illness for people who have severe disease. So that's going to require that people at each of your sites are validating test results, validating vaccination records, and validating medical records for people who require healthcare during the time period that we're interested in. So Alicia's put together the training today. She's also going to be working with all of you as we roll this out. She'll be a great resource to answer questions about how to abstract particular charts. The data system that Carrie and the rest of the DCC staff have developed is going to allow Alicia to work with you and see some of what you see, and also help to make sure that the data that we're collecting is really high quality. This is a little bit different from Covered, for those of you who are involved with Covered, in that all of this data validation being done at the sites is a really important part of being absolutely sure that we have the exposures and the outcomes correctly adjudicated, because if we have misclassification in those things, then our ability to answer these questions is going to be really limited. So Alicia, I'll turn it over to you.
Right. Hi, everyone. I'm Alicia. Like Dr. Moore said, I'm a PA in the ER at Iowa. I also work at Northwestern in Chicago. I'll be training all of you guys today. Let me pull up this slide. And sure. Okay. Can somebody verify that you're actually seeing my PowerPoint slide?
I see it.
Okay, perfect. All right, so just a friendly reminder for everyone to please mute if you're not speaking. Dr. Moore is going to be answering any questions you have in the chat box. If he can't answer them kind of just with his little message, then we can address them at the end. So welcome everyone. This is our agenda. We are covering what looks like a lot, but I promise you can do it. We'll get through it today. Thank you very much for the time during the holiday week for joining us for this as well. The kind of plan we're going to follow is just some general information. We'll talk about requesting medical records and the release of information forms. And then sort of the most important parts is understanding how to verify testing results, how to verify vaccination records, and then determining what healthcare utilization we are interested in when it comes to understanding the severity of disease. We'll also talk about kind of how we're going to validate the data that you guys are abstracting for us. And then there's a short quiz at the end, which we'll discuss later. So the first step here is just sort of acknowledging that as the coordinators at each local site, you guys are doing a ton of work here. The piece that we're kind of going to discuss today is the verification of event data, which is the vaccination, testing, and healthcare utilization. So the kind of key thing we want you guys to take away from this is that the manual of procedures, or the MOP, is going to be your new best friend. It has all of the information to assist you kind of throughout this whole project, particularly when it comes to doing these survey questions. There's step-by-step instructions in the MOP, which kind of correlates with each question. So we have an alphanumerical identifier, which when you're looking at the MOP will be in the left-hand column, and it's just sort of this random assortment of letters and numbers. It's also on the survey underneath the survey question. So if you're wanting to look up, let's say you're looking at the MOP and you want to figure out where exactly this question is, you can do Control F and then type in the identifier, and you'll be able to find exactly where that question is in the MOP. We'll talk later about how this alphanumerical identifier is also going to be very key if you guys have any questions when you're contacting us. One of the first things kind of to address is understanding when records need to be requested. So every participant will complete a release of information form when they're kind of doing their initial survey. The records that we want to know is all of their vaccination records for COVID vaccines and influenza vaccines this year. We want to know test results from kind of 14 days prior to symptom onset to 14 days after symptom onset. And then any healthcare utilization within this 28-day period as well. We'll go into much greater detail on each of these steps as we go through this, but we're keeping in mind here that we will be getting some records from employee health for a kind of bulk download, which will be kept at the local site. But there are going to be situations where participants are seeking care at other hospitals, they're going to private clinics, maybe COVID testing sites, things like that, where you are going to need to contact the facility and request those records, which we will discuss in further detail. Hold on, it's not, okay, there we go. So one of the first things we want to address is if a participant reports a healthcare visit that we, quote, don't care about, how are you going to address that? So on this survey form, there will be an option for you to select something that says no, basically that this is not a visit that you have to go through and verify. So from the get-go, I want to make sure that everyone understands mental health clinic appointments or admissions, telehealth visits, and scheduled visits at clinics that are not related to the current COVID or symptomatic illness are records that we do not care about for the purposes of this study. That'll be stressed a few times throughout this training, but just want to make sure that everyone is aware of that kind of upfront. So to start out with, you are going to be able to see release of information forms, and then also any forms the participant is uploading in red caps. So when they go through and fill out a survey, they complete a few questions that basically just says, what test are they reporting? Do they have a copy of that test record or medical record, vaccination record, whatever it is? And they will input that here, which is the second option on these surveys, which are on red caps. You can click this link and it will open the file that the participant has uploaded. If this is blank and there's nothing there, that means that the participant has not uploaded a file, and that means that you're going to have to request that medical record. So there's some instructions here on sort of how to get the file that you acquire and get it to that person's survey here. So if it is blank, you'll just click upload file and then choose file, go to the location on your computer where it's been stored, and then click upload. Release of information forms. Like I said, each participant is going to sign that form when they are initially completing their consent survey and evaluation. This is automatically uploaded into DocuSign. This is an example of the form from all of you, and we've already got it pre-selected to request basically all of the records that we may need. For each participant, it will input their information here, and then for each site, it should already say kind of who their information is being sent to. There's a couple of sites where we're still working with you on completing these ROI forms, but we anticipate them to all be in their final versions in the next few days. To access these release of information forms from DocuSign, as Carrie kind of went through last week, there's different sections on REDCap that show how to look into vaccine verifications, medical records that need to be requested, testing verifications, etc. You go into whatever category you're interested in, find the participant and record ID you're looking for, and then you'll go over towards this right-hand side, and there's just a file here that you can click on, and that will download the signed release of information forms from that participant. And then you can print those or email them, however you're going to end up requesting the records, which we talk about in a few minutes. The process for requesting medical records can be sort of complex. We are asking that each site kind of figure out the method and process that's going to work best for them. But this is a general overview of the key steps. So one is getting that release of information. Confirm that it's signed by the participant and it's for the facility that you're interested in requesting records for. Then you're going to need to contact the medical records office at that facility. If it's a hospital, it's generally just a medical records office, and they typically need to be contacted during business hours. If the participant went to a clinic or some sort of private practice, a testing site, you should contact that clinic directly. And it may be the first person that answers the phone that will help you with it, or they may transfer you to the appropriate contact. Typically, the contact information, phone numbers, or email addresses, if they prefer, is all listed on a facility website. So if you just open Google and type in the facility you're interested in and type in medical records, it should give you the instructions on how to contact them. You will then obtain the records from them. And once you have that documentation, you'll need to upload it into REDCaps, which was the instructions from a few slides ago, where if the participant hasn't uploaded anything, it'll say upload document here. One thing that we really want to stress is any information that you are obtaining needs to be kept confidential and very secure, because it's going to contain protected health information, and it's the employees at your hospital. So we need to make sure that everything is extra secure. So typically each facility will use fax, secure email. Occasionally people use normal snail mail to send medical records back and forth. Each site here is going to be responsible for sort of determining what system is going to work best for them. We recommend having options for both fax and email. And then just another reminder that these records contain protected health information and must be kept secure and confidential at all times. And just a reminder, if you're going to be requesting or sending this information via email, that you need to flag with the email as confidential. If you're using Outlook, there's just, the 3 dots in terms of settings up at the top, and you can click message options and click confidential or secure. If you don't have Outlook, if you're not sure how to do it, your local IT should be able to assist. I know multiple sites use different email servers, but we just want to stress that transmission of medical records needs to be kept secure. If you're going to be faxing, you'll need a cover sheet that says confidential. We recommend printing off a few copies to just have around that include your return fax number, so that you just have those papers. Anticipate it to take at least 1 to 3 business days for facilities to send records back to you after you've requested them. We are aware that some facilities may request a fee for a copy of those medical records. We have a letter from the CDC that's going to be on our website to essentially encourage facilities to give you those medical records because they are for a public health surveillance. We're requesting that they release them without charging the fee. If the sites are kind of giving you a big headache about that, you can contact us and we can try to figure out a way to help you. We also understand that some facilities use electronic information exchanges like Care Everywhere. Follow your own institutional policies regarding whether or not those records can be accessed through your local electronic medical records, or if you need to formally submit a request to obtain those records from the facility. Once you've requested the medical records, you will input the date into the REDCap survey. 7 days later, if you have not uploaded the documentation, it will show up in kind of the next category of surveys where it says records that have been requested but not uploaded. And it's a way for each site coordinator to keep track of kind of where they're at and what records they have and don't have. We can also see this information. So if you're having questions or concerns, let us know and we can kind of take a look at it as well. So the information you're going to be verifying is going to come from three main sources. One is going to be bulk documents, which would be reports that your local employee health center or vaccine registries that you can access. That information needs to be kept at your local site. We do not want an entire like Excel document uploaded for one participant because it will likely include information on other employees who are not part of our study here. So those need to be kept at your local site so that they're accessible to you, but do not upload the bulk documents into REDCap. Additionally, any bulk documents from the employee health clinic, if you've already determined that those records can be verified, then you don't have to go through all the steps of viewing the individual, let's say a vaccination card for a particular participant if you get the record from employee health. Any requested documents that come from other facilities will be the documentation that's sent back to you via fax, email, kind of whatever method you elected to use. And then another reminder, please keep it secure. And then if you have paper copies that were sent to you via fax, make sure that they're being discarded at whatever manner you have at your site for documents that contain PHI. So if you have shredder bins, then they go there. We also recommend that if you're using fax, don't send things to like a fax machine in the middle of the ED, just because we want to make sure that since it is employee information, that it's protected from the other employees at the site. We just want to make sure everything's staying really, really secure. Some sites have institutional policies that allow them to use their local electronic medical record if the participant sought care at the institution where they employed. So for example, since I'm an employee at University of Iowa, our institutional policies say that if I sign a release of information documentation for University of Iowa, our abstractors at Iowa can just log into Epic and search me and go through my record that way instead of formally requesting kind of paper documentation from our medical records office. If that is an option for you, then by all means do that. Just make sure that it is in line with your institutional policies, because there are some institutions where you cannot access employee records without contacting medical records. So just make sure you're following the policies that you have in place. So now getting to the testing records, the window we are most interested in is 14 days prior to symptom onset to the 14 days after symptom onset. So this 28-day window, we want to know tests that are obtained in that window. Records that you need to query would be occupational employee health systems, which they may just send you the bulk data set, medical records of the participant's primary care physician or a testing center if they report going to one of those. And then if the participant submits a photo or PDF or screenshot of their result, then you need to look at that as well. Test to be verified. So we're looking at several different tests here. The key one obviously is our COVID results, but we're also looking for other pathogens that cause respiratory illnesses. So we want to know if people were getting influenza testing, if they were getting mono or strep, especially now that we've gotten into the winter months. Many hospitals are using the entire respiratory pathogen panel to look for the other viral illnesses. We also want to know about urine antigen tests, sputum cultures, and bronchoalveolar lavages. Most participants are not going to have all of these tests. This is going to be kind of more your participants that have severe illness that are getting admitted to the hospital, or at least have had clinic visits. And we'll talk about kind of where to find these, but just being aware that you're looking at more than just COVID test results. If a participant uploads source documents and you need to review those, there's a few components that have to be there for you to be able to verify that source documentation. This is in section 5.72 of the MOP. Here is a screenshot of one of my COVID test results. So here we can see that it is like a legit test result. It's not just a piece of paper where somebody hand wrote positive or negative. It is missing this part where it's a definitive identifier that links it with a project participant. Nowhere on this does it have my name, my MRN, nothing like that. So if somebody submitted this test result to you from a screenshot of Care Everywhere or however they're getting it to you, this isn't going to work. They need to make sure it includes the identifier. We do have the date of the test. We have that the reporting organization or resulting agency was Emory. And then it says the assay type, which this is another key piece of information here. So the narrative has a lot of information that's not necessarily important for our study, but you need to identify this PCR as being the type. And then it definitively has to say the result. So you've got a reference range, and then the result here is negative. In this situation, since I screenshotted a result that doesn't include the information that you need, we would ask you to just contact this participant and say, hey, thanks very much for submitting this. Is there any way you can zoom out or kind of resubmit this documentation and make sure that it also includes an identifier that links it with you or whatever piece of information you're missing. This is another test result of another PCR COVID test that it says here, so your standard range is not detected, my value was not detected, but again, I gave you guys a garbage screenshot that doesn't include my name or a date. So those are two key pieces of information that are missing here. So again, if you're getting results from a participant that's missing the required information you need, please reach out to the participant, ask if they could submit new documentation with the additional required components. If they're unable to provide that documentation and you can't get it in the medical records, contact us and we'll kind of figure out what else we can do. And then a reminder, so this is a COVID antibody test. So we're looking at PCRs, antibodies, and antigen tests. A positive COVID antigen is sufficient to say that somebody is a positive case, but a negative antigen is not sufficient enough to label somebody as a control. Just a reminder for kind of how people are being categorized for this study. If somebody submits results that say pending, or if you're requesting medical records and it says pending, this result cannot be completely verified in our forms. So you'll need to contact the facility, request updated medical records, test results, or you could contact the participant either way on this form. So if you're looking, this is a survey, a screenshot from the surveys. It asks what the test result is. You would click pending, and then at the end of the form, it says form status complete. You would click incomplete because at this point you don't have verified test results. We don't anticipate this to happen very often because most tests are resulted within about 72 hours, and you'll probably be far outside of that window by the time you're requesting medical records or by the time the participant is uploading any information. But in the rare instance this happens, just note that a pending result cannot be formally verified. Getting to vaccination records, all of this information is in 5.73 of the MOP. The vaccine administrations that we care about would be all COVID-19 vaccinations. So this includes any of the recent vaccinations that people are getting right now, but then if they were part of any vaccine trials, we want to know about that as well. And then if they got an influenza vaccine this year after September 1st. A key thing here is that even if a participant says, no, I don't think that I got a COVID vaccination, we want you to search and kind of verify that. So we're asking that you at least look through the employee health kind of bulk downloads that you'll be getting, and then any vaccine registries you have. So there's basically two different options for accessing vaccination registries. One is the state registry that most sites I think should have access to. It's a site specific thing though, and exactly how you access that. And then there's this VAMS, which was created by the CDC, and it's supposed to be a nationwide registry, particular to COVID vaccinations. It's state and site dependent whether or not they're participating in the VAMS. So if you have access to that, great. If you don't, then kind of go through the other vaccine registries or records that you have. If the participant provides clinical trial letters documenting their arm allocation and it says that they got the COVID vaccine, that's perfect. If they submit copies of their COVID vaccination card and they upload it to their survey, you can review that. If they don't have a copy of that card, but say that they got the vaccine from somewhere else, then you'll just have to request the records from wherever they indicated that they got the vaccination.
Alicia,
Yep.
I just want to add one thing, because we've heard from several sites now that many of the state vaccine registries are integrated into Epic. I know that we have that at the University of Iowa, and other sites do too, where your own local medical record may be able to pull that information down for you. So if you're having a hard time figuring out how you might do that locally, your local employee health office oftentimes has some information on how you would collect those data, because they use vaccine registry data more than some of our project teams have probably in the past.
Thank you. When it comes to actually verifying vaccination administration, there's a couple of key components that you have to identify here. One is the date that it was administered. Most of these, at least for the COVID vaccination cards, all look basically identical. So in this column here, you'll find the date that it was administered, the vaccination type, where if it's COVID versus influenza. The COVID ones say at the top, an influenza vaccination record will also indicate that they got an influenza vaccine. The manufacturer and the lot number are conveniently very small on most of these vaccination cards, but the top line is going to be your manufacturer. In this case, it was Moderna. And then the second line is the lot number. We need to know that lot number for the COVID vaccinations. It's optional for the flu. So if somebody is able to provide you with the information of the lot number on their influenza vaccination, great. If not, then you can still verify that vaccination data. We also want to know that it was administered by someone. So most sites, it'll either be the nurse or whoever administered the vaccine, or this may just say the location where it was done at. And then you have to have an identifier to the participant. So their name should be on there. Their date of birth will also be on there. It may include their MRN number, but however you can confirm that that goes with the participant. And then this is the official CDC record card that everyone's getting. Every single dose of the vaccine that somebody gets needs to be verified. So for this participant who, well, that was me, I got one dose of the COVID vaccine so far. So you'll have to submit a survey form for this first dose. And then when I get my second dose, another survey would have to be filled out because that'll be administered on a second date. It'll have a second lot number, and we just need to keep track of that information as well. If you are unable to verify the vaccine administration, it's the same situation as if the participant says that they got a test done and you can't find that. First step is to contact the participant. confirm that the response that they gave was actually correct, and then confirm with them that they actually did get that vaccination. If they were in a vaccine trial, they submit documentation on the trial arm allocation. And this is just another reminder to check the vaccination registries and employee health records on all participants to confirm we're not missing any unreported vaccine administrations. Now when we get into reviewing medical records for healthcare encounters, this will probably be a pretty small percentage of our participants, but this is a key part of us understanding the severity of disease. So the healthcare encounters that we care about is any hospitalization. So an inpatient or observation hospitalization from 14 days prior to the onset of symptoms through 14 days after the onset of symptoms. An emergency department visit for any cause. So if I have COVID symptoms and I fall off a ladder and I go to the emergency department, even though it's primarily because I fell off a ladder, we still want to review that visit. For any unscheduled episodic outpatient care visit, like someone going to urgent care, a walk-in clinic, etc. And then outpatient clinic appointments, but only if they're in relation to the current or recent symptoms of infection. So if someone's just having routine follow-up with their primary care provider and it happens to fall within this 28-day window of symptoms, but it's not related to any of the symptoms, that record does not need to be reviewed. We are also excluding all mental health care visits and admissions, and then telehealth appointments. Our thought with the telehealth appointments is we're concerned about severe illness. If someone is having a telehealth appointment for their COVID-like symptoms, their symptoms are probably not very severe, or they would be evaluated in person. And a lot of people are part of these sort of kind of everyday or every other day screening calls where someone calls just to make sure they're doing okay. And we don't necessarily need to evaluate any of those telehealth appointments. If you have any questions on whether or not a visit counts, feel free to contact us and we can look into that for you. The records that are going to be reviewed, especially for hospital admissions, will kind of get extensive, but like I said, we anticipate this to be a very small percentage of the participants. The release of information forms already request all of these pieces of the medical record, but just to remind you, we're wanting to look at clinic notes, hospital record or ED visits, hospital admission notes, progress notes, consult notes, procedure notes, discharge summaries, the radiology reports. You don't need to look at actual images. You just need to be able to see the radiologist or what they said about it. We need to know any lab results and reports. So that includes culture results, microbiology, pathology, vital signs, which will come in the form of vital flow sheets, vaccination records, medication lists, and medication administration records, which is also called a MAR, and then a problem list, which is considered the patient summary list or past medical history. For any of you who may not be super familiar with how we write our notes in terms of healthcare, there's some consistency between like admission notes, which are also called H&Ps, ED or emergency department notes, and then daily progress notes, or which can also be called SOAP notes. This is just a kind of outline to give you a general idea of what information can be found in what portion of the notes. Particularly admission notes and ED notes, your very first couple paragraphs is going to give you a description of the course of illness thus far and what prompted that patient to present to the hospital. If they were transferred from one hospital to another, it should also be included in this information. And this is a piece of information that you're asked on the survey and will need to be able to identify. The history is where you should be able to find the participants' medication list and their previous underlying conditions. The exam often includes at least an initial set of vitals. And then there's typically an area that has kind of important data results. So abnormal labs, abnormal imaging results, etc. The medications that have been administered, and then a plan, which is in the admission note versus ED course, both sort of give a description of key events and then the plan going forward. So in the ED, if somebody was intubated or had big procedures done, if they were admitted to the floor versus the ICU, that should be listed in this ED course. And then for the admission note, the plan typically divides things up system by system, not always, but that's the general format we use. Progress notes or daily notes, SOAP notes, these are short. They will be updated every single day that the participant is admitted to the hospital. The first part includes the important events of the last 24 hours. The objective part would be the physical exam, recent vitals. Typically, a physical exam will list if the patient is intubated. It will say something like ET tube in place. The assessment would be a review of new tests or imaging results. And then the plan, again, it's generally broken down into systems, not always, but generally. And one of the key parts of hospitalizations that we're interested in is if a participant is requiring supplemental oxygen or vasopressors, sort of other ECMO, things that are indicating that they're having really, really severe illness, that will be found in this plan part. This is another just sort of resource for you. So unfortunately, each site and each hospital system, each electronic medical record will have information in different areas. You'll kind of get familiar with the system that you have, but this is general information on where you can find these types of results. So if you're looking for vitals, it should be in the daily progress note. It's also typically found in nursing notes and vitals flow sheets. If supplemental oxygen was used or if the patient was intubated, that will be in an ICU progress note, again, under nursing notes and vitals flow sheets. Particularly if somebody was intubated, respiratory therapy often has a note in the system as well as sort of a progress note that will describe the oxygen settings that they're on. If vasopressors were used, this will be listed. So one is if vasopressors are used, the participants in the ICU. So you'd be looking for an ICU progress note. It's typically listed either under like cardiovascular or it may be listed under medication drips. And then the medication administration record or the MAR is sort of going to be your best friend for deciding if someone was on vasopressors. In the MOP, we have a list of what constitutes as a vasopressor. Imaging results, the easiest place to find that is in radiology reports, but may also be listed in daily progress notes. Past medical history is found in the ED note or admission note, usually in the beginning component. There's also an active problems or history list that you will get that should include their past medical history. The survey asks for admission and discharge dates. So if you're looking for an admission date, this would be the date the H&P was written. It can also be found on the discharge summary towards the beginning. It'll say date participant was admitted, date participant was discharged, and you can find those pretty easily there. And if the participant was transferred, this should be listed in the very beginning of the ED note or the admission note, saying that participant was sent from outside hospital or sent to us from this facility via ambulance or helicopter or however they got there. If a participant was transferred, you will have to fill out a survey form for their initial encounter. Let's say they went to an ED in like middle of nowhere, Iowa, and then got transferred to the University of Iowa. You will fill out a survey form for that middle of nowhere ER, and then you will fill out a survey form for their admission to University of Iowa. So basically every separate encounter needs a separate survey. Categorizing the past medical history, this is really, really important. And definitions and categories have been created by the CDC so that we can maintain uniform responses across all sites. So we're asking that when you're categorizing someone's past medical history that you follow very specifically the instructions in the MOP, which is section 6.3. We've also put a link on our project website for a document that has just this information so that you don't have to go through the pretty long MOP. There's also a category that inquires about if participants on any medications that cause immune suppression. There's an appendix at the end, Appendix E, that includes what the CDC has determined as common immunosuppressants and chemotherapies. So you can just Control F and search the participant's medication. If it's listed, then you would consider them immune suppressed. If it's not listed, then they're not immune suppressed. And this is just a screenshot of what that appendix looks like at the end. So it's got a generic name and a trade name column. If you have any issues with a survey item, such as you're not really sure how to respond to it, you can't find the information, you just don't understand what the question is asking, then we would like you to send us an email. One thing to include is the alphanumeric code, which is found underneath the survey question. If it's related to a particular participant, there's a record ID that's listed before you open the survey. It's this numbers kind of here. If you can include that record ID, then it helps us view the particular survey that you're having questions or concerns about, or if you're needing us to review medical records that are affiliated with that survey, that's how we can identify exactly who you're referencing. If you tell us what institution you're from, that also helps us to narrow things down further and then give us a description. We will respond to you within 48 hours. Oops. We will be verifying abstracted data. So every week we're going to randomly select records from each site and just make sure that the data that's abstracted matches what the MOP suggests should be abstracted. If there's any concerns or kind of any disagreements regarding the information, we will reach out to you. We ask that you please respond to us within 2 business days. There's going to be a 15-question quiz regarding abstraction. This is the opportunity for you to start getting yourself familiarized with the MOP. We're asking that each team member who's going to be doing any data abstraction completes this quiz. We also want the site coordinator to complete the quiz, even if they're not going to be doing the majority of the abstraction work. The thought with that is that your local team that's doing abstraction can contact you as the site coordinator with the questions that they have, and you can reach out to us if needed. We ask that you have at least one member of your team complete the quiz within 7 days so that we can release your site to do the medical record abstraction. If the quiz is not passed or there's any kind of confusion, I will reach out to you, or you can email us and ask particularly what your question is. To access the quiz, you can click on the link or scan this QRS code. Each site's also getting an email that has the link. And I think everybody got an email of this PowerPoint today, so you can also open that and just click on the link. And
Also a link on the project website. If you go to the project tools, there's a link to the quiz that you can go.
perfect. I look forward to working with all of you guys. This is my dog, Ollie. He's crazy. He loves tennis balls and water. If any of you have any questions, please send an email to our DCC email. If you need to contact me personally, this is my Iowa email and my cell phone number. And we look forward to working with you guys. It's going to be fun.
Thank you, Alicia. That was so good. We're going to have to recall the subcontracts and put in a non-compete clause so no one tries to recruit you and steal you. Are there any general questions before we sign off? I thought that was a super good orientation and training. Obviously, you'll learn as you go, and we will learn too, for those few things hopefully that we didn't anticipate.
There were some questions that came up in the chat. I think that they've all been addressed, but if anybody still has questions after reading the responses in the chat, please feel free to read those or to raise those now. The other thing that I just want to highlight is that of the 10,000 people that we're going to be recruiting and enrolling for this project, the vast majority of them are not going to be requiring healthcare. So there are a lot of really detailed things that Alicia went through that I think is really important because we need to make sure that it's uniform and right. But for most of the participants, you're going to be able to get through this pretty quickly because there aren't going to be long, detailed hospitalization records.
All right. Any other questions before we sign off? All right. Well, Happy New Year, everyone.
Happy New Year. We'll look forward to working together in 2021.
Yeah. Oh, and Leah, we'll post this on the project website, the recording of this training, as soon as it's ready.
It'll be in the same area with all the other recorded all-site meetings.
Thanks, everybody.
Thanks, everyone.
Thank you.
Thank you.